Can a fatty liver cause your spleen to enlarge? Simple fatty liver disease doesn't typically cause spleen enlargement, but if it progresses to cirrhosis with portal hypertension, splenomegaly can develop as a complication. And that distinction really matters. Most people with fatty liver disease won't experience spleen problems, especially in the early stages. But as the condition progresses, the connection between these two organs becomes important to understand. So let's talk about why that happens, what to watch out for, and when to speak to your doctor. Fatty liver disease, medically called hepatic steatosis, happens when excess fat builds up in liver cells. It's surprisingly common in the UK, affecting around 1 in 3 adults to some degree. It's often linked to obesity, type 2 diabetes, and metabolic syndrome. There are 2 main forms: non-alcoholic fatty liver disease, or NAFLD, and alcohol-related liver disease, where fatty changes are an early stage. Here's the key point. Simple fatty liver, early stage steatosis, does not typically cause your spleen to enlarge. Fat in the liver on its own doesn't directly affect the spleen. So if you've been told you have a fatty liver and you're worried about your spleen, that's an important distinction to hold on to. The concern arises when fatty liver disease progresses. In some people, the liver doesn't just accumulate fat, it becomes inflamed. This stage is called non-alcoholic steatohepatitis, or NASH. Over time, repeated inflammation can lead to fibrosis, scarring of the liver tissue, and in more advanced cases, that scarring can develop into cirrhosis, where healthy liver tissue is largely replaced by scar tissue. Not everyone with fatty liver disease will reach this stage. Progression depends on factors like age, metabolic health, genetics, and lifestyle. But when cirrhosis does develop, it can trigger a chain of events that affects the spleen. Here's how. Cirrhosis disrupts the normal flow of blood through the liver, causing pressure to build up in a large blood vessel called the portal vein, a condition known as portal hypertension. That increased pressure backs up into the splenic vein, which drains blood away from the spleen. When blood can't drain properly, the spleen becomes congested and begins to enlarge. This is called congestive splenomegaly. An enlarged spleen can have real effects on your blood. The spleen normally filters old blood cells, but when it's enlarged, it can become overactive and start removing too many healthy cells, a condition called hypersplenism. This can lead to low counts of red blood cells, white blood cells, and platelets, which doctors refer to collectively as cytopenias. These can cause symptoms like fatigue, increased susceptibility to infections, and a tendency to bruise or bleed more easily. It's also worth knowing that spleen enlargement has many possible causes that have nothing to do with the liver, including blood disorders and infections. So if splenomegaly is picked up on a scan or blood test, it needs to be properly investigated to find the underlying cause. If you have a diagnosis of fatty liver disease, there are things worth discussing with your healthcare professional. Ask about monitoring your liver health over time. Non-invasive tests such as FIB4 and ELF scores can help identify whether your liver is showing signs of fibrosis or progression. These are important tools for catching changes early before complications like portal hypertension develop. Your doctor can also advise on managing underlying conditions like diabetes or high cholesterol, which may be contributing to your liver disease. When should you seek medical advice more urgently? If you experience persistent pain, fullness, or heaviness in your upper left abdomen, that's worth getting checked. The same goes for unexplained fatigue, frequent infections, or unusual bruising or bleeding. If you already have a liver condition and notice any of these symptoms, don't wait, contact your GP. So to recap, simple fatty liver disease does not typically cause spleen enlargement on its own. The risk comes when fatty liver progresses to cirrhosis and portal hypertension, and that's when splenomegaly can develop as a complication. Regular monitoring is key to catching progression early, so speak to your healthcare professional about what's right for you. Nothing in this video is a substitute for personalized medical advice. If you have concerns about your liver or spleen health, please speak to your GP. If you found this helpful, leave a comment below We'd love to know what topics you'd like us to cover next. And if you haven't already, please give this video a like and subscribe to the Bolt Pharmacy channel for more health information you can trust.